Hi, my name is Dr. Sumaira Rashid, and today I will be talking about dental ethics, and that is Chapter 4 in the Modern Dental Assisting Textbook, Edition 13, from the authors Bird and Robinson. Ethics in general deals with moral conduct, the right and wrong behavior. It's basically what we talk about in terms of good and evil. So overall, especially in the dental field, it includes values, high standards of conduct, and personal obligations reflected in our interactions with other professionals and patients. In these cases, there are few absolutes and there's more gray areas. So there's not decision making that involves a lot of yeses and nos. Sometimes it's like, it's not that black and white, in other words. So there's many gray areas in these situations. And of course, because of that, it's subject to interpretation. It's what should I do? Why should I do it? It refers to what you should do and not what you must do. Ethical standards are always of a higher order than minimum legal standards established by law. So a behavior can technically be unethical, but still be legal. But it cannot be illegal at the same time and still be ethical. Some personal ethics that are learned throughout our life would be just plain and simple, basic instinct. Maybe perhaps from your parents or a guardian, someone that kind of taught you throughout your life what is right, what is wrong. Teachers, professors that you've been exposed to, religions, any religion that you've been a part of, observation of other people's behaviors, just upon reflection of what you've seen, and then you develop your ethics, you develop your personal ethics. Actions and decisions of healthcare providers are guided by ethical principles. So what you learn throughout your life will follow you through even into this dental assisting career. There are 6 basic principles of ethics that your book has mentioned. There is autonomy, or the regard for self-determination, non-maleficence, or basically to do no harm, beneficence, the regard for justice, veracity, okay, or truthfulness, confidentiality, privacy, and continuing education. Okay, so autonomy is more self-determination. It's the right to freedom of choice, self-responsibility. Okay, non-maleficence is basically do no harm. Okay, beneficence is to actually do good or provide a benefit. And justice is plain and simple fairness. And we had mentioned veracity is to tell the truth, and confidentiality is never revealing any personal information about the patient. This is listed on table 4-1 in your textbook. It comes right from it. Autonomy. Okay, autonomy, or the regard for self-determination. As long as no breakage of law, and that's where it gets, of utmost importance. With autonomy, there's a right to privacy and freedom of choice. There's acceptance of the responsibility for what a person does. The person does have a freedom to think, to judge, and act independently without due influence. An example is the right to refuse recommended treatment. You can't force a patient to do what is proposed during their treatment planning options at a dental visit. They have the right to refuse treatment. Is it against the law? Absolutely not. Okay, but they have that freedom of choice. Non-maleficence is to do no harm. I think we had mentioned a few chapters ago a little bit about Hippocrates and I believe a little bit of the Hippocratic Oath. Okay, so to do no harm basically comes from the dictation from Hippocrates. It's basically the most basic element in morality, just plain and simple, to do no harm. An example of this is if an action may cause harm and it cannot be considered moral. Okay. Beneficence deals with actions that are ethical as long as they will benefit a person or community. This is a pretty self-explanatory explanation. An example of this would be volunteering in a dental health education program. So it's ethical and you're benefiting the actual community, you're giving out to the world. And a regard for justice, treating people fairly and giving what they deserve and what they are entitled to receive. For example, the same quality of dental care it should be given to everyone regardless of their race, ethnicity, level of education, or even the ability to pay. Everyone has the right to know what is wrong with their teeth, if there's a pathological issue, anything like that. Also, they have a right to know what are their options, no matter what, even if they can't afford an implant, for example, but they have the right to know what are the treatment options for them. Veracity is telling the truth. An example of this is telling a child that the dental procedure will not cause pain when in fact it may. So there's many times where some dentists out there or some auxiliaries out there say, oh, it's not going to hurt at all. But that is not a good idea. It's very important to tell the truth. You may tell it in a comforting fashion, but to lie to a patient can actually do harm. Confidentiality is the right to privacy concerning a patient's healthcare and treatment choices. What happens in the room stays in the room, no matter what. Even if they're a celebrity, it doesn't matter. Legal and ethical, there's a legal and ethical obligation. Some exceptions, of course, are if you suspect child abuse or if you're not sure of the age of the patient. Okay, no matter what, confidentiality has to be explained to a patient. I'm sure many times you have gone to a dental practice or any medical office and you receive the confidentiality forms that you have to sign or initial, or you receive some sort of confidentiality pamphlet dictating or saying to you that the office will respect your privacy and nothing will be shared. However, there are instances where some information must be shared. For example, if a patient seeks treatment, seeks dental treatment, for example, at a specialist's office, and they were referred to by a dentist, of course that specialist will need information, all the records that coming from the provider that referred them to. So in those cases, information must be shared. And of course, if the patient is a minor, okay? Let alone if a patient you have suspected that there is some child abuse, then there is no confidentiality in that sense regarding the abuse. Then, unfortunately, Child Protective Services is contacted, etc. Privacy, some of you have heard about HIPAA. We did talk a little bit about that in the previous chapters, and that stands for Health Insurance Portability and Accountability Act, and that came in 1996. It's enforced and very definite. It really has definitive legal requirements that's related to confidentiality of a patient's health information. We also mentioned continuing education is really important in dental ethics. It's an ethical obligation of dental assistants to maintain and update their knowledge and skills. The DANB requires evidence of CE for CDA to remain certified. We talked about this in the last chapter as well. Some are required by certain states as part of a renewal process. A lot of them are available online and through association meetings and even home study courses. When you become a dental assistant, you go through the Professional Code of Ethics, okay? You promise that. And basically the Professional Code of Ethics is a voluntary standards, not laws, but they're set by members of the actual profession. It's a method of kind of self-regulating within the profession. It states what is the ideal behavior. It can be revised periodically, but it's established because of several reasons. There is a reason why we have this code of ethics in place, and it's to demonstrate a standard of care, to enhance ethical consciousness and ethical responsibility of their members. It's also to guide members and dental assistants in making ethical decisions, moral decisions. It's also to establish a standard for professional judgment and conduct. Okay, your book has a little bit of a cutout of the American Dental Assistants Association Principles of Ethics here. Okay, this was established in 2011, this one, and it gives you a whole slew in a list fashion of the legal and ethical guidelines that are expected by patients, employers, and employees, and in many areas required by regulatory boards. Yeah, I wanted to share a little bit of these two slides with you. The code of conduct as a member of the ADAA, they do talk a little bit about this. This is also present in your book, but a whole big list. So I had to kind of divide up the list a little bit because it was too long. So I made it into two separate cutouts. But again, you see all these bullet points, you know, and what a dental assistant would pledge to do when you become a dental assistant. You know, for example, it says, I pledge to abide by the bylaws of the association. I pledge to maintain loyalty to the association. I pledge to serve all members of the association in an impartial manner. I pledge to maintain high standards of personal conduct and integrity. So there's a lot of promises when you become a dental assistant in regards to professional code of ethics. Okay, several dental assistants, you know, you can find them gossiping in a reception area in your office, and several staff members. You know, there's many people out there that you'll find, you know, a little bit of small talk, and the small talk then goes into gossip about so-and-so, about so-and-so. So, you know, it is strongly recommended, and I cannot stress this enough, to ignore the gossip and apply the principle of non-maleficence, doing no harm. Okay, that includes talking about someone, because, you know, honestly, it turns into a he said, she said, and before you know it, you get caught up in all these different talks in the clinic, and it may hurt your employment, or it may just make you turn a bad leaf. So you don't tell your friends who the famous celebrity was that sought care at your office, right? So you are applying the principle of confidentiality in that case. For example, if you had Jennifer Lopez or Madonna or anyone that came to your office, believe it or not, you cannot tell anyone, no matter who they are outside the clinic, that so-and-so came to you for dental care. You have to apply confidentiality. Okay, another thing is you find the owner's wallet with cash and credit cards, and you decide to return it. In those cases, you're applying principle of justice. You know, however tempting it could be to take someone's wallet with, you know, with the wallet with cash in it and everything, I mean, you have to have, you know, ethical principles, and the good thing is to return it back. Okay, in those cases, you're applying the principle of justice. Of course, there are ethical dilemmas that you will come in contact, and of course, that comes with experience. When one or more ethical principles are in conflict, for example, when the principle of avoiding harm is in conflict with the principle of autonomy, self-determination in a specific situation. When the dentist believes the treatment is in the best interest of the patient and the patient chooses another option. You know, autonomy versus do no harm. We go back to that same concept. The dentist may choose to perform the procedure that the patient prefers only if that procedure is within the standards of patient care. So if a patient says, you know, I appreciate Dr. So-and-so, you gave me this choice and that choice. I don't want to do that. Can I just do something else like this on that same tooth? If it's within the standards of patient care, the provider can go ahead and perform that treatment. But if it is not, then the dentist, by all means, has the right to say, can refuse treatment, says, you know what, I can't do that because that is not within the standard of patient care. Okay. It is unethical, however. Let's say, for example, if a dentist performs a procedure that is below the standard of care, and just because the patient wants it. Okay. And you hear that often. Well, the patient asks for it, the patient wants it, got to give it. And I've seen that in many offices, but that's not ethical. Patients overall, they want healthy teeth, for example, extracted. Let's say somebody, like overall, you see a lot of patients say, you know, I want this tooth extracted, or I have a snaggle tooth here, I just want it extracted. Just so he or she could just, I don't know, they don't have to brush, for example. Let's take it to a really extreme measure. Take out all my teeth, I don't want to brush, take them all out. So whenever you're confused, you could go back to the same example. You know, would you do it? Would you take all their teeth just so they don't have to brush anymore? No, absolutely not. Again, it goes back to autonomy and self-determination. What are the steps for solving ethical dilemmas? When ethical dilemmas are complex, you got to use some basic steps. And the book basically tells you a little bit more about like a roadmap or a draft in terms of how to tackle something like that. You can identify the alternatives first, see what the choices are. You can determine the professional implications, what should or should not be done. Okay, you want to rank the alternatives. That allows you to know that you did your best. Okay, what's the first choice? What's the second choice? What's the third choice? Okay, you want to sort it out. You also want to choose a course of action ultimately. You want to make a judgment or a decision based on the steps. Thank you so much.